Hi, this is Sam Collins of the American Acupuncture Council, specifically the Education Division. And here we are giving you another month of some education to make sure that your practice can thrive and survive. And actually, we hope that your practices continue to grow. And part of that growth is going to be obviously likely through some patients who might have insurance. The confusion, of course, often is, well, what does insurance pay for? Where do I go? What diagnosis will they allow, not allow? And so what we're trying to do in today's program is try to give you a little idea of what the specificity is of the different diagnoses that different insurance allow. Unfortunately, it's not as uniform or as consistent as we'd like to see it. So our goal really is to make sure that you get as much information as possible to know the different type of insurances that you're billing on what codes they may or may not allow. If for no other reason, you can inform your patient when there is or is not coverage. So without further ado, let's kind of just get started. Let's bring into some slides here to make sure you can see what's occurring with acupuncture. So initially here you just see our goal and our commitment is to strengthen and grow the acupuncture profession by providing education, tools, and support that continually improve productivity, profitability, and well-being for the alternative community as a whole, meaning for acupuncture, of course. So my email's at the bottom, so you're always welcome to send me an email. We do have a network service, of course, where it allows you direct contact with me, but certainly if you have some questions, you're welcome to send in an email question about this. The bottom line is, let's understand what the heck is going on, what is insurance, and what do we really have here? Okay, well then we really start with, what is insurance? And I think there's often a misnomer about what insurance is. It is not health insurance. In fact, that's why I put a question mark with it. Health insurance is not what we stated is. It's really sick insurance. There has to be something wrong with the patient. We have to make them better. It's not preventative in design for the most part. There may be some aspects that may be, but for the most part for acupuncture, generally it's going to be for pain management, meaning something that is wrong. So let's get into what are the coverages. Does all insurance cover acupuncture? Of course not. Of course, as many are aware, there is no mandatory benefit for acupuncture except for 5 states, and that of course could change depending on how the healthcare bill passes through Congress or doesn't. The bottom line is though that a lot of policies do have acupuncture coverage. A big issue is to verify and find out what coverage does the plan you're dealing with have. And one of the most difficult parts is when you call them, you might want to know, well, what diagnosis do you pay for? And unfortunately, most insurances will give you the, we can't tell you, it's just pain management. So today what we want to do is give you some information that's very specific. So let's start with one of the first ones in a very prominent pair, which is Aetna. Aetna does have and can have some pretty good acupuncture coverage, but it's a good understanding to know what they really cover. So let's take a look at the Aetna policy for acupuncture. You'll notice this policy is policy 0135, and it's the Acupuncture Clinical Policy Bulletin. It's something that Aetna updates every year and for allowances for acupuncture. Now, one thing to note here, notice the last review was just this past March because there's been some changes to this, and the next review will be next January. So it's important to know that every year you want to do a little follow-up and do these. It's one of the reasons we teach continuing education seminars because there's always new information and changes. We want to keep you up to date. So let's start first here where it says policy. So if you look here where it says policy, notice it says most Aetna plans limit coverage of acupuncture when it is used in lieu of anesthesia. So what does that really mean? That means, of course, that they only cover acupuncture when you do it kind of as an anesthetic prior to surgery, like for God knows what, but maybe a dental procedure. The good news is, while that is certainly something they may have, I have found through my experience that most Aetna policies generally will cover for pain management. So bear in mind, when you first do a verification for Aetna, don't assume that when you say, do they have acupuncture coverage, that answer means for the type of services you're providing. If the policy limits to anesthesia in lieu, that means it's only going to be prior to surgery, not typically for pain management. However, when it does cover acupuncture in the way that you think, it's going to be in this format. Notice here it says, some other plans may extend acupuncture coverage or acupuncture for medically necessary indications, but only when administered by a healthcare provider who is a legally qualified physician practicing within the scope of his or her license. Now, that is an important detail to remember because I'm sure some of you that are hearing this have been in practice long enough to recall when insurance companies could indeed deny acupuncture benefits when performed by an acupuncturist. And of course, due to the law changes under the Affordable Care Act, they made it illegal for that. So now they have to cover within scope. So in other words, if they do cover acupuncture, they will have to cover it by a licensed acupuncturist, obviously. So here it goes on to continue to say that Aetna considers needle acupuncture, and of course, that's what acupuncture is. You have to insert needles, medically necessary for the following indications. Now, here's where you're going to get some very specific information as to what they cover. The coverage they cover is, first you'll note here it says chronic, minimum of 12 weeks duration for neck pain, or chronic minimum of 12 weeks for a headache. So in other words, they're covering kind of chronic neck, chronic headaches. Also, of course, they're going to cover low back pain. They're going to cover nausea of pregnancy. And notice here it says pain from osteoarthritis of the knee or hip as an adjunctive therapy. In fact, it says pain in the knee or hip as an adjunctive therapy. You're going to say, well, what does adjunctive mean? Meaning in addition to. So notice it's going to indicate pain in the knee or hip or post-operative chemotherapy-induced nausea and vomiting. So in other words, it'll cover nausea and vomiting of pregnancy, post-operative chemotherapy-induced nausea, but notice the pain in the hip and the knee. Notice very conspicuously, it doesn't indicate places like the shoulder or the wrist. So therefore, you're going to start noticing, well, is that going to be covered? And under Aetna, it is not. The next thing it covers, it says, is post-operative dental pain. So certainly we'll cover issues where a person's had some type of dental surgery or tooth removal for pain. So something to consider, it's likely that they'll start covering not under their dental insurance, but under the Aetna insurance for post-operative dental pain. They do also cover for TMJ disorders. But notice that's a pretty limited list of services. So this is the list that they're saying they're covering. So bear in mind, Aetna, though is a good payer, has a very limited amount of coverage that they may do. Note also it says here, maintenance treatment where the member's symptoms are neither regressing or improving is considered not medically necessary. So in other words, clearly I want to make sure is that they're saying that if it's maintenance, they're not going to pay. So it can't be just to feel good. It can't be to keep the patient feeling good. They have to have actually a deficit. It goes on to state if no clinical benefit is appreciated after 4 weeks of acupuncture, then the treatment plan should be reevaluated. What they really mean by that is likely discontinue. Here's the good news. When you do perform acupuncture to most patients, it's not unusual for that patient to likely have improvement after just a few visits. Maybe by 2 or 3, you're already noticing a change, therefore it would be appropriate. So this kind of gives a good idea of what they do allow, but probably better is that they do actually publish a list of codes. So my suggestion is that you may want to start gathering a list of your common codes and see, do those common codes fit for the services under this plan? So take a look here at the top. It says, if ICD-10 codes are covered, if selection criteria are met. And it means it just has to meet what we just stated. Notice though it says parenthetically, not all inclusive. My frustration with that, of course, as I'm sure it is for you, not all inclusive means that these are the codes that they'll cover, but they're saying not all inclusive because there may be some additional ones. Well, clearly the first thing they're going to cover, notice, is migraine headaches. But you can notice this is a very big list of codes, G43001 through G43919. Now there actually is not 900 codes for migraines. There's more about 40, but it's going to cover every code in between there. So it's going to have a pretty nice little level of coverage. In addition, the next code, K08.9, it says disorder of teeth and supporting structures, and that's for your post-operative dental pain. So notice the code actually doesn't state tooth pain, but that's actually what that code means. It's any disorder of the teeth, including pain. Then notice the next codes, M160 to 1612, osteoarthritis of the hip. So in fact, it does cover osteoarthritis of the hip, whether it's primary or secondary. So notice we have primary or secondary, or just plain osteoarthritis. So the good news is, yes, it covers osteoarthritis of the hip. Notice continuing down, osteoarthritis of the knee, osteoarthritis of the knee again as a primary or secondary. So what's interesting to me though is please note, as I'm circling around here, that it does cover knee or hip pain or arthritis, but only those areas. So if a patient has arthritis of their shoulder, not going to be covered. Arthritis of the hand, not going to be covered. What is well covered, though, are these temporomandibular joint disorders. Notice these codes, M26601 to M2669. These codes are for all your typical type of TMJ issues. There's a lot of codes here, but TMJ dysfunction is probably the most common. And so M26601 would be the right, and if it were the left side, M26602. So that's well covered. It also covers cervicalgia or neck pain. So notice M54-2, and then they put here parenthetically chronic. And again, remember that says that greater than 12 weeks. So make sure based on history, it's not just simply acute. What's very good is that this is a new provision for Aetna. Aetna up to last year would not cover neck pain. They actually only would cover low back pain. So now indeed they are covering the neck. That never made sense to me if you really think of it. If acupuncture could help in the low back, why would it not help in the neck? So I think they probably take that same logical step as well. Notice also they do cover low back pain, M54.5. They also cover excessive vomiting in pregnancy, so that's all your nausea of pregnancy. And then you're going to notice this next one, nausea with vomiting post-operative or chemotherapy induced. So a patient that's had chemotherapy or any type of medication that causes nausea, going to be covered under R1112. So these are the exact ICD-10 diagnoses. This is great. My problem with this, of course, and as I'm sure you likely will witness, this is a pretty limited list of codes. So while Aetna can be a nice payer, the listing of codes is pretty small. So if you're going to bill Aetna, if you use one of the codes on these lists, I will guarantee that they will pay. If it's not on the list, it's likely not payable, but possible. So one of the things you want to make sure is if your patient comes with a condition that really doesn't fit something like this on the list, then certainly you want to make sure to let the patient know it's not going to be covered. Now, bear in mind, something like cervicalgia and low back pain are pretty broad. There's obviously lots of conditions, maybe several dozen that can cause these symptoms. So clearly just have to make sure to keep it coded with the simplest, which is pain. You notice here for the most part, outside of these conditions, it's kind of pain, arthritis, which all leads to pain other than the nausea, vomiting. So Aetna, while a decent payer, doesn't cover a lot of codes. So be careful. Aetna patient comes in, know the coding. This is the list that they produced, won't update until March of next year. Now, another payer that's pretty prominent that does have pretty good coverage, of course, is Cigna. Cigna is a national payer and can have some pretty good reimbursement for acupuncture. And while it has a limited list as well, it's much broader than is Aetna. So let's take a look. This is the Cigna policy. And you notice here it's policy 0024. And it was effective this year in March. And the next review will be next March. So this, again, if it's going to update, will not update until next year after March. Now, a couple of things about their criteria I think that's important to note as an acupuncturist is this. The first bullet here says treatment is expected to result in significant therapeutic improvement over a clearly defined period of time. In simple terms, you know what that means? They want to see that your patient has gotten better. Therapeutic improvement means obviously a loss or a decrease in pain and an increase in function. They want to see an individualized treatment plan and goals with frequency duration, which I think most obviously do. You're going to generally start off with, I'm going to treat this patient 2 times a week for 3 weeks, something of that nature. Now, what do they cover? Let's take a look here. The conditions, nausea, vomiting, nausea, vomiting, nausea. So in other words, if you have a nausea practice, you could be pretty well covered. In fact, I will guarantee for the most part, every insurance that covers acupuncture will definitely cover nausea. But notice, just like Aetna, they do cover postoperative dental pain. They also cover, though, migraine or tension headaches, osteoarthritic knee pain, neck pain, and low back pain. Now, this again seems pretty limited, but wait till you see the list of diagnoses, because all of these conditions that I'm circling around here actually can have many causations. Now, be careful. It does note here, Cigna does not cover acupuncture for the following services because it's excluded. So notice it says here, treatment intended to improve or maintain general physical condition. That's your so-called maintenance or kind of preventative. While the patient may want that, and I think it's a good thing, that is not covered by insurance. In fact, it goes further to state maintenance acupuncture services. When significant therapeutic improvement is not expected, Cigna does not cover either the following because each is considered experimental. So point injections. So in other words, just not maintenance and things of that nature. So do be very conscientious. Now, what do they not cover? Now, what's interesting, notice they say they don't cover at the very bottom here, acute pain, addictive behaviors, including chemical or tobacco, allergies, weight reduction modality. Now, that's something that's interesting. They won't cover weight reduction for acupuncture, meaning needling, but certainly within your scope in many states, the weight loss counseling could be covered. Then notice things here are like asthma, attention deficit disorder. Those are not covered. So you can look and go, wow, that's a lot of things that they aren't covering. Well, that is, but that list of what they do cover, let's take a look at just the first page of 3 for Cigna. For Cigna, here's what they're noting that they do cover. So you can notice right off the top, the ICD-10 codes indicated here are going to be things like migraines. Migraines of all type, just like Aetna, but notice this big list of chronic type tension headaches as well. They will also cover the R51, which is the regular headache. In addition, though, notice these codes, acute post-thoracotomy pain. So often you'll say, well, what's the code for post-surgical pain? Well, this would be it, G8912 if it's surgery to the chest. But what if it's not to the chest? Then we have other acute post-procedural pain. In other words, pain after surgery anyplace else. Notice vomiting. And now notice they give you the codes for osteoarthritis of the knee, much similar to Aetna. Now, what I do think is interesting, though, is that they cover spondylosis. Now, of course, as I'm sure all of you are aware, spondylosis, M4711 through 28, are the codes for basically spinal arthritis. And so this is when they're indicating arthritis with myelopathy is covered. Now, what I would say to that is, of course, spondylosis is arthritis with myelopathy. Is that painful? So how would I code that if we're an Aetna patient? I could simply code it as neck pain. But what I think is nice for Cigna is that Cigna is allowing a little bit more differentiation, because certainly if you said a patient had spondylosis with myelopathy in the cervical region, would certainly be worth a few more visits than would be just cervicalgia. So they are a little bit more specificity. So you notice as this list goes down, in other words, they're covering all types of spondylosis or arthritis of various types. You notice as that list continues, it has spondylosis with radiculopathy, and then, of course, spondylosis without myelopathy or radiculopathy, so just plain arthritis. So instead of it just being simple neck pain, they're allowing a much more differentiation. In fact, you'll see down here it continues with other codes such as spinal stenosis. So again, bigger list, but of course, could you just still call it pain? Yeah, I guess you could, but I like the specificity because it allows you to, when you get a referral with a patient with this level of condition, it's going to allow for more visits. Well, let's continue on. Next page. Notice spinal stenosis continues. But notice these codes, M50.00, M50.01, those codes say cervical disc disorder with myelopathy. So what these codes are indicating is that obviously these would cause a neck pain, but this is a much more severe condition, meaning that you're giving more of a Rembrandt-style diagnosis, because clearly a patient with cervical disc disorders with myelopathy is going to need many more visits than would a person with just plain cervicalgia. So in other words, all of these conditions you see on this page will cause neck or back pain, but they're just allowing a much deeper level of differentiation. Now, special note here, just a quick one, the codes here, M50.020, 021, 022, these codes actually were just recently updated this past October. So you may have a list of codes that may not be up to date, because these codes did update as to differentiation a little bit more. And you notice the same thing here for disc displacement. Think of it this way. A person comes in with a disc bulge of 12 millimeters in the spine. Even though you could certainly call that cervicalgia, I would say much better to say the disc displacement, because that's going to be a patient you know is going to take a lot of visits. So again, just down this entire list, you notice all the cervical disc codes, all the spinal disc codes are covered, whether it's degeneration or otherwise. So much more differentiated. And again, notice the amount here, disc degeneration, disc disorders, disc displacement in every level of the spine. So again, a broader allowance than previously what we saw for retina, because it allows a differentiation. And we're still not done. Let's go to the next page. The next page you'll notice is a continuation of disc disorders, but then you'll see two interesting codes here, cervical cranial syndrome, cervical brachial syndrome. The most common one likely might be the cervical brachial syndrome, M53.1. That is a code when a patient generally has pain in the neck extending to the shoulders and hands, hence called the syndrome, kind of numbness, tingling pain. So a little bit broader, but of course, could you just stick with cervicalgia, M54.2? Of course. You can just say, hey, it's cervicalgia, it's neck pain. However, if it were cervical brachial syndrome, and if that was the cause, I would prefer to have it, because clearly an insurance company is going to make a decision as to how many visits or how much care a patient should get based upon the severity of the diagnosis. Cervicalgia, while a code that does indicate pain, is going to be much more specific for the level and severity if you can use something like cervical brachial. Notice also the codes for sciatica, M5430 to 32. These codes differentiate to left and right, and so certainly instead of just saying back pain, you can indicate the sciatica. Notice they have a code that also indicates low back pain with sciatica, the M5440 to 42. So in other words, you can identify, is it just sciatic pain, meaning pain in the leg, or is it sciatica with low back pain? But then of course they have other low back pain as well, just plain M54.5. But then they have this code here, M5489 other dorsalgia and M54.9 dorsalgia unspecified. What these codes could be used for is for conditions that you can name but don't otherwise have a code. So for instance, other dorsalgia might fit when a patient has facet syndrome or something that doesn't have its own code, or dorsalgia unspecified similarly. What is happening here is Cigna is just stating that you don't have to use simply low back pain, but you can name the condition a little bit more. Now notice also these codes here, M9901, 03, 04, and so forth. These are the codes that chiropractors actually use for so-called subluxations. So segmental dysfunction, subluxation. So those codes alone, if you got a referral from a chiro, you wouldn't even have to put pain. You could certainly put subluxation. Notice also the level of stenosis codes they have here, the M9931, stenosis, whether it's osseous, connective tissue, and we'll continue down that list. And you'll notice the connective tissue here, disc stenosis. I think the thing to take away is notice the giant list here comparatively. Aetna had probably about 10 codes. This one here is hundreds potentially based on the type of condition a patient has. We're still not completed though. Let's continue on. It continues with the osseous codes, connective tissue, but then notice it also doubles back with the hyperemesis gravidarum. That's the code, of course, for nausea, pregnancy. But then notice they give a little bit more here. Nausea, vomiting, unspecified, vomiting without nausea, projectile vomiting, and then nausea with vomiting. So again, all of your nausea codes certainly can be covered. So the good news here is that your list for Cigna can be much broader. You don't simply have to state neck pain. You can be more specific. That doesn't mean you have to. Could you just simply code neck pain or back pain? You certainly could. But my concern would be if the patient has a disc disorder and you're aware of it and can code it, that's certainly going to give more rise to potentially much longer need for care. Patients probably going to have greater tendencies towards flare-ups. So in other words, by giving that higher level of specificity of diagnosis under Cigna, you likely can get the appropriate amount of care. I don't always want to say that it's more visits as much as I want to make sure the patients have the appropriate amount of care. So now we covered two. So two of these insurances, Aetna and Cigna, both have some variations, but some similarity. Well, let's go to the big one that most are aware of course, Anthem. And Anthem is the parent company, of course, Blue Cross and Blue Shield nationally. And there's going to be some variations from state to state, but I want to kind of give a general, very broad statement what they say for acupuncture. So here's the Anthem policy. You notice this policy was last reviewed in November and became effective this last December. But truthfully, it hasn't changed much. It says this document addresses the use of acupuncture to stimulate specific points. So it explains acupuncture. And it says treatment for nausea and vomiting. And it kind of lists here, it says the use of acupuncture is considered medically necessary for treatment of painful chronic osteoarthritis of the knee and hip that is significantly affected by daily activity. So now when you read those, you might say to yourself, well, my goodness, this is a pretty limited policy. When in fact it isn't. It's interesting how they state that, because when you move to the very bottom of the policy, they're going to give you, of course, here at the bottom, things like the codes allowed, meaning acupuncture. But notice what it states at the very bottom for diagnosis codes. It literally says all diagnosis. Now, I want to be careful. That's not going to mean all diagnosis in the way that we might think at first glance, but all diagnoses that have been useful for acupuncture. So I'm going to give you a little bit more information on that as we come up, but I want you to think along the lines of pain, because certainly they're not going to cover appendicitis, but what would they cover? Probably some pain associated maybe, but be very careful that they're not going to cover colitis. They're not going to cover some internal disorder, because those are ones they're going to say are experimental. Always think of it from a pain management standpoint. So even though it says all diagnosis, be very careful of using a code that likely doesn't have a pain component. Well, to give a little further rise to that, here's one through Excellus. Now, Excellus is the major coverage for the East Coast, particularly for New York, New Jersey, upper East Side area. Anyway, they give a little bit more specificity. It says, policy statement, based upon our criteria, assessment of peer-reviewed literature, acupuncture is medically appropriate when performed by the individual licensed by New York State to perform acupuncture when performed for the following diagnosis. Now you're going to notice, well, is this going to go back to what we've just seen? Well, not quite, because take a look here. Adult postoperative nausea and vomiting, okay, chemotherapy-induced nausea and vomiting, pregnancy. So you're going to say, okay, that's a pretty similar list of nausea. But then notice here, Cigna and Aetna both specifically said no to carpal tunnel, but notice they're saying no, carpal tunnel will cover fibromyalgia, headaches, low back pain, notice here, menstrual pain, myofascial pain. Notice it says here osteoarthritis. So Cigna and Aetna pretty much said osteoarthritis of the knee or hip only, but now notice they're just saying arthritis, in fact also specifically indicating tennis elbow. Now, this coverage actually comes from, if you were to read up on the National Institutes of Health, that's one of the things that they indicate, as well as the things that acupuncture can be helpful for. So if you stick within this range for a Blue Cross Blue Shield, you generally should have no problem being paid. Notice the basic premise is pain, but they're not allowing it just to say knee or hip only, for instance, with arthritis. Well, let's take a look at another one. This is a company called eviCore. This is their list. eviCore does a lot of review of acupuncture claims for Blue Cross Blue Shield or for Anthem. And I think it's pretty interesting as to the codes that they give, because you'll notice right off the bat under headaches, cervical cranial syndromes, headaches, migraine with aura, migraine without aura, or unspecified migraines. So again, a little bit broader on the basis of headaches. But notice for cervical conditions, they go so far as to talk about brachial neuritis, degeneration, post-laminectomy syndrome, post-surgical meaning, stenosis, cervical brachial. So again, notice the broadness of the coverage here. Notice cervical conditions here, cervical spondylosis. But interestingly, notice cervical sprain strains are covered. Now you may say, oh, that's good, they cover strained sprains. For the other plans, for instance, with Aetna or Cigna, how would you code a sprained sprain? You may think, well, I can't code it. Well, you can't code sprained strain specifically, but what does a sprained strain cause? Pain. Therefore, if there's a sprained strain in the neck, how would you code it for Aetna Cigna? Simply code it as cervical pain or low back pain. Obviously, I would prefer to give a code that's more specific because a strain sprain gives a little bit more detail, but nonetheless, there's ways of working within that to make sure that it fits. Notice also for thoracic spine, they kind of do the same thing, the disc syndromes. Notice thoracic outlet syndrome, lumbar disc degeneration here, lumbar radiculopathy. So again, much broader, but of course they do have the sciatic codes we went through. But then of course they do go with the low back pain codes, the spondyloses. Notice also the strain sprains. But what's very nice is notice at the bottom here, the upper extremity conditions. Things for the shoulder, M75, 51, and 52 is so-called frozen shoulder. You know, that's the code for that. But then of course strains and sprains, carpal tunnel. But notice here, joint pain and osteoarthrosis, in the hands and the arms, lateral epicondylitis, so-called tennis elbow, medial epicondylitis, so-called golfer's elbow. Well, let's continue down. You notice here, even for the lower extremities, it'll cover ankle and foot as well. Let's go to page 2. On page 2 of this document, notice even ankle sprains, chondromalacia, knee and joint pain. Notice here, knee tear and medial meniscus. So again, they're not just saying arthritis, but meniscal tears. Obviously, ACLs. Notice piriformis syndrome. Again, the so-called sciatica from the piriformis. Piriformis syndrome is G5701 and 02. Now, what's interesting about this code, if you were to look this code up, G5701 and 02, it won't say piriformis syndrome. It actually is lesion of sciatic nerve. That lesion comes from the piriformis syndrome, hence the use of it. Notice plantar fasciitis. Now, something interesting about plantar fasciitis, notice plantar fasciitis M72.2 is just one code. I'm sure most of you are aware that most codes in ICD-10 give you a right and left component. Plantar fasciitis does not, so it doesn't matter left or right, just M72.2. Then, of course, there's thigh sprains and pain, fibromyalgia, jaw pain, and then myalgia. Now, here's the basic differences. Fibromyalgia is, I think, an interesting code because that deals with it from more chronic basis. Myalgia is acute muscle pain, you know, a few areas. Fibromyalgia, for the most part, is just more severe, meaning it's chronic, multiple areas, so more than one. In fact, there's some will argue that it takes at least 12 to 18 points. But in addition to that, it's also associated with 3 other things pretty prominently, which are headaches, sleep disturbances, and fatigue. So again, acupuncture here coding very well for those. And then notice things like allergic rhinitis. So there are some companies that will cover for things just plain allergies in the nose. Notice asthma, hyperemesis gravidarum. So again, we go back to nausea and vomiting. So this one for Evacor is a pretty strong coverage. And again, that's something you want to verify. If the plan does have Evacor as their review, can have a much broader sense of it. Now, let's take a look at another big payer, United Healthcare. United Healthcare can offer some pretty generous benefits for acupuncture, but again, they have a limitation as to what they allow. So let's take a look. Under Aetna, they tell you what acupuncture is. It says it's the gentle insertion of hair-fine needles. I love how they state that because it makes it clear if a patient were to read this that it's all gentle. But what we really want to get to is what is it saying that it does. So here in the second paragraph, it says acupuncture has been endorsed by the National Institutes of Health as an appropriate treatment for pain and nausea. So again, for the most part, if you give me pain, likely going to be covered under United Healthcare, just make sure it's pain. And then goes on to say it may also be useful as an adjunct and an acceptable alternative to be included in a comprehensive management program, notice, for addiction, interesting, stroke rehabilitation, headaches, menstrual cramps, tennis elbow, fibromyalgia, myofascial pain, osteoarthritis, low back pain, carpal tunnel, and asthma. So if you notice that, if you go back to that Evacor one that I showed you just a moment ago, as well as the Anthem Blue Cross policy, this all starts to sound pretty similar. My following a recommendation to you would be to make sure that it sticks within here, meaning pain. So the safest bet for any payment for acupuncture is always a diagnosis that manifests in pain or is pain itself. Now, what does it say it's not reimbursed for? So that's something that shows here. It says continued repetitive treatment without an achievable and clearly defined goal. So they're not saying maintenance care per se, but very specifically that you have to have a goal. When a person has a chronic condition, they'll likely flare up, have some decrease in function. Treat that. When the function returns to normal, then we likely release them. So again, they will allow for flare-ups and exacerbations. It says, obviously, any treatment rendered outside the practitioner's scope of license. Now, again, under the Affordable Care Act, remember that your scope of license, depending on your state, can be pretty broad. Some states have a very generous. The acupuncturist can do all types of physical therapy and adjunct services. That certainly would be covered, so long as it's within scope. What they don't cover for is weight loss or smoking cessation. So those two things they certainly would not cover for. Well, what else do we have out there? There's another group called health partners. Now, this is more in the western part of the U.S., and this one's a little bit broader, but I want to bring this one up, even though it may not affect some of you, is to see how they cover it, and a good way of starting to understand when you're documenting, when you're diagnosing the patient, what things an insurance company will look for. So let's take a look at this health partners. Health partners doesn't cover unlimited, but they cover 12 visits. Well, 12 visits is not the best, but it's better than getting nothing. So what do they cover? Number one, it says acupuncture treatment is generally limited to the following conditions. And notice the first thing it says as analgesia for medical procedures. Now, what is analgesia for medical procedures? That's the in lieu of anesthesia that we went through with Aetna earlier. But what I do like here is the B, chronic pain syndromes, and it says including but not limited to. And notice how broad this is. Neuromusculoskeletal conditions, examples, neck, back, extremity pain, radicular syndromes, myofascial pain syndromes, fibromyalgia syndromes, and then, of course, headaches, chronic or recurrent tension or migraine. Now, what I like here, including but not limited to. So in other words, they're saying kind of similar to United, Anthem, that they'll cover pain. It does also say it covers nausea. And then I do like here, it talks about PMS and menstrual disorders. So it does cover those as well. But what is good is this next factor, and this is something to consider even beyond diagnosis. It says prior authorization for patients with a new condition is limited to 12 sessions per year. But for authorization and beyond, it says so long as it's documented improvement in those of the following areas that are relevant, the condition being treated, they can likely get more. So here's things that you want to definitely think of when you think of medical necessity. These are very important to document. And I think most acupuncturists do, because this is the way you view your patient. It's not just a patient that it's pain only, but how that pain affects you in many ways. So notice one thing they give an importance to in 2A is general fatigue, lack of energy, strength or endurance, inability to complete a normal day's obligations or tasks. So for instance, when a patient comes in, they're in pain, some of the questions you are likely asking your patient, well, because of this pain, how is it affecting you? You know, I can't fall asleep, I'm waking up too early, I'm feeling fatigued. So long as you're indicating those factors and showing improvement, that's proving your care is necessary because of the improvement of function, not just pain relief. Always note, pain reduction is always going to result in increased function. 2B, mobility, agility, range of motion, ability to sit, stand, and walk. So these would be factors I would emphasize to all acupuncturists to include as part of your protocols for medical necessity, because certainly as your patient reduces pain, these factors are going to improve. Notice in C, sleep disturbance, difficulty falling or staying asleep, waking too early, not rested upon waking in the morning. Finally, in D, just simply says decreased quality of life, negative mood, poor coping ability, emotional resiliency, significant relationship strained. So I know a lot of you often will have questions like that, and those are things you deal with your patients. Realize there is an importance to these factors. These factors can, in fact, help to display how good and effective your care is by showing improvement in these. The key factor is please be sure to document them. Show me the changes. And again, it may be subjective, but it's still giving you changes with the patient. Okay, now they're saying the authorization could be granted, but they're also going to look at two other factors here, and I think they're important. In 3A, it says an improvement of at least 3 points on the numerical scale. So I do want to highlight, a lot of you will use a pain scale and your patient says, oh, it feels a 7. Technically, it's not really better unless there's a 3-point move. So when a patient goes from a 7 to 6, well, I won't say that that's not better. It's not significant enough. So if it's not greater than 3 points, your reliance is going to be, I don't care about the points as much as how is it affecting them in some other functional aspect. Or if you look at something like, I'm hoping most of you are familiar with something called an oswestry. So you'll see here in 3B, it says a total of 10 points improvements on sections A through E. And what that's referring to, if you're familiar with the Neck Disability Index or an oswestry, those have point values, and those point values have to approve at least 5. The good news is when most acupuncturists use those type of tools, it improves quite a bit. So Health Partners gives you a pretty good tool here to say we cover a lot of things, but they too produce a list. And again, I think it's a good idea. You may want to start creating a list of what your common codes are. And then on that list, make sure, has there been any problem with any one insurance that's paying or not paying? And then that way you can make sure that if you have an Aetna patient coming in and you're saying it's fibromyalgia, we have to know they're not going to cover it unless you can identify that fibromyalgia is going to be in the neck or back. So let's take a look at Health Partners. Health Partners gives a very nice list of codes, in fact, a couple pages long. The one that's interesting that jumped out at me and maybe to you is A1801, and it says tuberculosis of spine. Now, when I first see that, I think, well, my goodness, I'm not sure I'd be treating someone with tuberculosis of the spine. Maybe, maybe not, but I think what's interesting here is, what does tuberculosis of the spine cause? It's going to cause pain. Therefore, there's the allowance. But notice the things they cover here: migraines, headache syndromes, chronic pain syndromes, pyogenic arthritis, rheumatoid arthritis, inflammatory polyarthropathy. In other words, all the things that can cause different types of pain, all the different types of arthritis and osteophytes. So you can just take a look down the list, even things that are just pain in the joint. So just tell me the joint hurts, they're going to cover. And notice these codes, M2550 through 579, means it's going to cover all levels of the joints. Again, we'll continue down here: deforming dorsopathies, ankylosis and spondylosis. And some of this you might think, oh my God, I'd never see a patient with that. Remember, often an acupuncturist has a patient referred that's with a chronic problem. If you already have that diagnosis, certainly use it, because again, those type of codes are going to give you many more visits. Notice also, again, towards the bottom here, different codes like the disc displacement and disc disorders, much like Cigna. We go to the last page that they have, and notice they do cover things like radiculopathy, cervicalgia, sciatica, so forth. Notice too, they cover things like fasciitis. The key factor here is you're going to diagnose your patient. Let's make sure, does that diagnosis match or fit the conditions or the allowance of conditions of that particular carrier? So I've given a pretty good list here, or a list of certain carriers that you can have. But let's take a look at one that's come up recently that I'm sure some of you have noticed. There's a program now called the Veterans Access Choice. It's called the VACP program, Veteran Access Choice Program. And this does allow for acupuncture benefits. The key factor here is, depending on what part of the United States you're in, if you're on the West Coast, you're going to join a company called TriWest. If you're on the East Coast, you're going to contact a company called HealthNet. And I'd suggest just a Google search for TriWest Veterans on the West Coast, TriWest Veterans on the East Coast for HealthNet. What this plan does, though, is it allows for acupuncture benefits for veterans who are dealing with pain management. And of course, as I'm sure many of you are aware, there's an opioid crisis going on in the U.S. And in that opioid crisis, there is a lot of issues for increased use of medication, addictions, and other things that just aren't that effective. They're allowing up to, I've seen as many as 52 visits in a year, meaning the person can come once a week. I've seen them as little as 6 or 12. You can always request more. But what I want to emphasize is, when these patients come with Veterans Choice, you want to be coding the pain that they're in. And here's what their expectations are of the Veterans Choice. It says the expectations of service for acupuncture treatment include this: significant durable pain intensity decreases. So kind of notice that's why I put the Health Partners in. Show me that the pain is decreased. But remember, the 3-point rule or the 10-point rule, depending on what you're using. Or probably what's better is, and I love that they pointed out, functional improvement demonstrated by clinically meaningful improvement on validated types of disease outcome instruments. So this is going to be your Oswestry types, general pain index, and so forth. So make sure you're including those. But things of activities of daily living. And then, of course, probably an important factor that I'm sure you're noting: documented decreased utilization of pain-related medications. So when the patient comes in, obviously you can't tell them not to take medications, but I'm certain a patient's going to relate to you, hey, I was taking, 4 Advil a day or whatever we're taking as a prescription. And all of a sudden when they're indicating, hey, I'm not taking half of that or a quarter of that, that's a very important factor, because that's what they're looking for. They're realizing that acupuncture is a very accessible and easy service to provide, yet offers great outcomes. So I see a great future here, because I think we're going to see a lot of help for veterans. But again, stick within the pain, because you'll notice what they're looking for. So now I've given you about 5 different insurances here, and I want to make sure you know where you can get these on a regular basis. At the American Acupuncture Council, we offer something called our digital coding service. A digital coding, what it is, it's a code manual that's online. If you're interested in it, and I'll show it to you in just a moment, please, when you register for it, use the coupon code that says SAVE2017 when you purchase. That'll take $20 off, making it only $69 a year. Here's why I will tell you I think you need it, because it's going to give you a simple way of looking up codes. So the digital coding is something that once you have it, it gives you access to this, what you're seeing on the screen now. So one thing for sure that I want to make sure that you can see where we have these documents is once you have this, or if you have it already, you're just going to simply scroll down once you log into the site, and you'll scroll down here to where it says Document Library. And in the document library, once you open it, it's going to bring up all of the things we have in the library. So one of the things we have in the library, it says Acupuncture Coverage Policies. And in there, you're going to notice we have Aetna, Blue Cross Blue Shield, Cigna, HealthNet, Health Partners, United Healthcare, and these always keep you up to date. Notice even in Blue Cross Blue Shield, we give you several, so you can see that there's more than one, or Aetna. So we try to make sure these are always updated, giving you the latest and greatest information on diagnosis. Also, when it comes to billing, I want to make sure that if you have this protocol, you can go in, and I'm just going to open up here, it says Claim Form. When you have this program, notice it will pull up a 1500 claim form for you. And all you have to simply do is go in and type the information, print it out. In fact, you can save this so the next month that you have your patient, you can then simply from that patient go back, open it up, and rebill. The important factor here is to make sure, do you have the right code to get paid for by that carrier? So one of the things to look up is just say, well, I'm not sure of the code. So we went in and say, well, what if I have back pain? Notice I'm just going to type in the word back. And when I click search, one of the things that you'll find when this comes up is you're going to see the codes that all have different types of back pain. So the most obvious one first is going to be this low back pain or lumbago. Or you can type in cervical or anything. What we want to make sure is that as a provider, do you have the access to make sure that your services can be paid? So at the very least, when you take insurance, you're not guessing. You are understanding what the coverage is so that you can make sure to inform your patient that this can be covered, that or it is not covered. So what we're looking for is that, do you have the right tools and information to make your practice thrive in the changing world of insurance and coding? It's not that hard, but you have to make sure that you have the right tools. So what we tried to give you today was about 5 to 6 insurances that gave you some very specific information, but also want to keep you up to date. So if you have a moment, take a look at that digital coding, or at the very least, make sure just the information I've given you, you give the best opportunity to help your patients get reimbursed for their services. Because remember, insurance billing is not a requirement. It's something you do as a courtesy unless you're a member. At the very least, make sure your patient has a receipt or a super bill so they can get some money back for your services, because if they can, they're more likely to continue. And until next month, I'm glad that you're with me, and next month we'll bring you some more exciting information on how to make sure your practice thrives and survives.